The topic I decided to write about in my paper is a comparison between type 1 and type 2 diabetes. I'm mainly going to be talking about the difference between the two, complications of both of them, and pertinent nursing assessments to be performed whenever you're caring for a patient with diabetes. Diabetes type 1 and type 2 are different in the mechanisms that cause them. Diabetes type 1 is caused from an autoimmune response in which the body attacks its B cells that are responsible for making insulin. And type 2 diabetes, the body has enough insulin, but it doesn't use it correctly. So type 1 diabetes is termed the insulin-dependent diabetes, and it can't really be prevented. It's normally diagnosed at a young age during childhood. Type 2 diabetes can be prevented with diet and exercise. And also, type 2 diabetics are normally controlled with oral antidiabetics, and insulin may be needed on top of that to control high glucose levels. So some complications of both of them cause angiopathies, which is disorders of the blood flow and blood vessels. So different opathies is neuropathy, retinopathy, and nephropathy are three main ones that I discuss in my paper. Retinopathy normally leads to blindness, so it's important that these patients get routine eye exams done. Nephropathy is whenever the buildup of excess glucose causes damage to the tubules and damage to the processes within the kidneys, leading to kidney disease. So it's also important to be monitoring the urinalysis and monitoring the BUN, creatinine, and glomerular filtration rate to see if these patients' kidneys are working properly. And neuropathy is pain, weakness, and loss of sensation in the peripheral extremities. This also becomes a problem because these patients normally can't feel when they hurt themselves, and they can get really bad skin breakdown and skin ulcers and foot ulcers, which is why it's so important that we teach these patients proper foot care. Education is really the most important, I feel, as far as nursing when working with these kinds of patients, because if you educate them on it, they're more likely to stick with their diet regimen and be more careful what they're doing. But yeah, that's the main differences in how to care for a patient with diabetes.